We are the Association of Nigerian Private Medical Practitioners.
Intellectual being, warm greetings from Ekiti State. Permit me to recognize and usher to the stage His Excellency Dr. KAYODE FAYEMI, CON. Please, can we put our hands together as we take his remark? Very ably represented by the Honorable Commissioner for Health in Ekiti State, Dr. Oyebanji Filani. Please, can we put our hands together for him, please? Thank you. Thank you very much.
Let me start by appreciating the group for the very rich display and representation of culture in the dance. And secondly, to appreciate everyone here for maintaining the safety protocols and adhering to standards, given that Nigeria is currently moving towards a third wave of the COVID pandemic. I'm here on behalf of His Excellency, Dr. John KAYODE FAYEMI, to deliver this goodwill message. The chairman of the occasion, distinguished Senator Henry Namani, the representative of the Secretary to the Federation, the Labor Union President, representative of Complementary and Alternative Medicine, my former Minister of State and Senior Policy, and of course the dynamic ANPMP President. It is with great pleasure that I deliver this goodwill remark on this important landmark, centenary celebration of the Association for General and Private Medical Practitioners of Nigeria. I would like to start by congratulating the association for this great milestone. It is indeed a worthy celebration. The role of the association as providers of healthcare delivery is such a critical one, given that 60% of health service delivery is offered in the private sector here in Nigeria. It is therefore important to ensure that we work together in order for us to be able to deliver on our goal of achieving universal health coverage. The challenges in the Nigerian health sector are all known to us. So unlike doctors, I will try as much as possible not to hide it under ambiguous terms like CA or metastatic lesions, and we'll avoid dwelling on them, but try rather to speak about the road to recovery, especially in the light of prevailing realities caused by the COVID-19 pandemic. It's been 1 year and 5 months since COVID-19 changed the world, from seemingly simple behaviors such as regular hand washing to the other extreme such as lockdown and travel restrictions. This small virus has made the world, and indeed Nigeria, realize that we are just one disease away from global destabilization. Before the pandemic began, we had set several milestones for ourselves, including achieving UHC by 2030. Yet, we're faced with the sad reality that COVID-19 has disrupted health systems and economies. In less than 2 years, the pandemic has caused a setback in development gains achieved over the last 25 years. Across the world, we've seen the impact of this pandemic on the livelihoods of people. And as a country, we're experiencing our worst, we're just getting out of one of the worst recessions we've ever had. The limited fiscal space at the federal level has affected states, and as such, we've had to adjust our spending and priorities to ensure that we stay afloat. These prevailing fiscal realities have adverse effects on the poorest of households. But while we mitigate the immediate consequences of the pandemic, we must also focus on building back our economy and health system for tomorrow. An economy and health system which is resilient to health crises and economic shocks. prioritizing recovery plans that tackle multiple challenges, Nigeria can recover in a way that is more inclusive, sustainable, and resilient. I've used the COVID-19 pandemic as an example to show us how diseases and weak health systems can destabilize lives and economies. Now to the solution. What do we need to do as a government and as citizens? I would speak on three critical areas. The first, increase investments in health security. Neither individual governments nor the global development community can entirely prevent the emergence of diseases. However, we can be better prepared by strengthening our health system through investment in health security. Investing in health security not only saves lives, but is also a vital investment in the wider economy. In Ekiti, for instance, we have taken advantage of the COVID-19 pandemic to strengthen our public health security. We have decentralized testing to 145 testing centers, the highest in the country, and improved our disease surveillance capacity to pick up early signals of possible outbreaks. Investing in the capacity of health workers. There is obviously a need to address the challenges in human resources in health. Challenges in training, continuous professional development, amongst others, should be prioritized and addressed. The quality of our health workers certainly reflects the quality of our health system. It is therefore pivotal to invest in continuous capacity improvement. In my state, for example, Ekiti, we're focused on redistribution, capacity building, and reward of our healthcare workforce. At the primary care level, for instance, whereas this time last year, 50% of our nurses and midwives were spread across only 5 of the 16 LGAs, we have now redistributed our nurses and midwives within the senatorial zones to ensure a more equitable access to skilled hands. We have also trained over 30% of our existing primary healthcare workforce, with more scheduled to be trained this year. We now recognize standout performances and celebrate our workers monthly. We're very much aware that these non-financial incentives have proven to be powerful motivators in the workplace environment. We are mindful that beyond redistribution, certainly more needs to be done. In the last 1 year, we've recruited more than 20 doctors to support service delivery in our primary and secondary care facilities. We complemented these efforts by establishing an NYC Medical Fellowship, in which NYC copper doctors are actively encouraged to work in rural settings in Ekiti State. The fellowship was born out of the realization that in the past, more than 50% of copper doctors posted to Ekiti State relocated immediately after camp. Today, as I speak with you, we've managed to retain 99% of all doctors posted to the state since the advent of the medical fellowship. Similarly, we have developed a program to utilize services of doctors at our teaching hospitals to complement the existing staff at our general hospitals. This program aligns with our goal of increasing utilization in these facilities, with incentive payments to the doctors aligned with the composite number of patients seen. Our investments in infrastructure has moved away from building new hospitals to modernizing existing ones and providing the relevant equipment to work with. In addition, we have strengthened our drug management agency with a relevant enabling framework, and we expect in a short while that we'll have a more structured system that is aligned to global good practice. Given the investments we've made in human and physical resources, data measurement and use has become even more important. Only last week, we signed a partnership with a foremost electronic medical record solutions provider to enable us to collect, collate, and synthesize health records electronically and in real time. Health financing. To set our state on the right path and enable us match our ambition with our vision, we tripled our capital budget from 1 billion to 3.2 billion in 2021. In addition, we have deepened our public health financial management processes by consolidating donor resources into our budget. We have earmarked resources as well, fund a defined and explicit set of high-impact services under our health insurance agency. This deliberate approach that we've taken to strengthening our health system goals have begun to yield fruit. Anecdotally, there's been an increased interest in the use of health services by households in the state. And latest data indicates that we have increased our immunization coverage rate to 86%. The journey to achieving our goals requires 1,000 steps, but we have taken necessary actions, mindful that, like Johnny Walker said, we must keep walking in the right direction. Before I round off my address, I would like to touch briefly on the ongoing strike by the NARD. Whilst the issues raised are relevant, the effectiveness of strike as a tool for negotiation are up for debate. As doctors, I would like to encourage everyone that our approach to labor and work-related issues must focus on compelling and irrefutable arguments that provide an opportunity to gain friends and sympathies across several industries. We will continue to work with you to ensure that we come to a meaningful conclusion and ensure that you are all able to get back to work as quickly as possible. As a bonus point, I would like to mention that there's a strong economic rationale for investing in health. I know it as a governor. Most of my colleagues now understand it given the COVID-19 pandemic. And we are mindful that healthier adults are more productive and our healthier children are more likely to remain in school. Investing in health brings measurable benefits to the nation, lifting many out of poverty and ensuring universal health coverage. Finally, I'd like to thank you and the association for the honor and for considering me worthy of the award. Once again, I want to congratulate the association for general and private medical practitioners on this landmark celebration. It is my hope that all the lessons shared at this event will be carried forward and implemented towards the health, resilient, and sustainable health system.
Greatest measure of a nation's wealth is the health of her people.